Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Do you recall a time when your gums bled while you performed your oral hygiene routine? Or have you ever considered how untreated bleeding gums can affect your oral health over the long term? Although it might seem insignificant or trivial, this issue could be a sign of a greater concern. And if you are interested in seeking answers to these questions, this discussion is definitely for you. Hello, everyone. I'm Dr. Soumya Saluja from SIP Media. And in this discussion, we'll cover the fundamentals of bleeding gums with Dr. Ketan Rajput, who will help us comprehend this particular issue better. Dr. Ketan Rajput is a dental professional with a specialization in periodontology and implantology, having graduated from the well-regarded Nair Hospital Dental College in Mumbai. He has made significant contributions to academia and is recognized for his expertise in laser dentistry. Dr. Rajput offers workshops on laser dentistry across the country through Laserpedia and has published both nationally and internationally. Dr. Ketan, SIP Media welcomes you.
Thank you. Thank you so much.
Okay. So without wasting any time, I would simply get on to what exactly are the causes of bleeding gums, because I think bleeding gums have become a very prevalent issue among individuals. And the underlying causes, they often remain misunderstood. And even from my experience, I have noticed a lack of understanding among most people regarding the same. Could you just elaborate on the various reasons behind bleeding gums?
Okay. Before addressing this question, I would like to thank you for having me on this online platform, the Healthy Indian Projects. And
Thank you so
coming
much.
towards your question, the bleeding gums, we have various causes for bleeding gums. So
Right.
coming towards the most important and the most common cause for bleeding gums, it is the buildup of plaque or calculus. So what
Right.
actually calculus is, to address this in a very common words, I like to say that it is nothing but your food debris getting accumulated over a period of time on your tooth surfaces. But that is not just your the food debris. They're
Right.
accompanied with a load of bacteria as well as saliva, and they
Right.
together form a very hard tenacious structure, which you cannot easily cleanse with your toothbrush or your toothpaste, right?
Right.
So this gets on depositing, and that eventually leads to bleeding gums.
Okay.
Apart from that, we have various other causes like vitamin deficiencies, like vitamin C or vitamin K deficiencies. Then we
Right.
have hormonal imbalances taking place in the body, like during pregnancy or during
Okay.
puberty, you can say, right?
Right.
Then we have other metabolic disorders like diabetes mellitus, hypertension, thyroid, or
Okay.
we can say various other medications like people taking blood thinners, for example, aspirin and all. People
Right.
are subjected to have bleeding gums more often, right? Then we
Right.
have stress or other conditions in which the patient is more likely to have bleeding gums. Okay.
Right.
And the most common cause, which I guess in day to day practice, everyone must have noticed, that is that whenever we have any hard substances to chew or
Right.
that impinges onto our gums, that causes bleeding. Or even if
Okay.
you are having hard bristle brushes or you're brushing too vigorously and that
Right.
causes injury to your gums, that can also cause bleeding.
Okay. So, so when it comes to bleeding gums, as you just mentioned, that even improper brushing or hormonal
Right, right,
conditions or medications, they usually lead to this problem. So obviously, we'll be requiring quick action and early therapy.
right.
So, uh, so I think for that, understanding the distinguishing characteristics and clinical symptoms of bleeding gums could be very beneficial. So, would you kindly describe the cautionary signals that people should look out for?
Okay. So for this question, I like to say that whenever you have some kind of discomfort in your oral cavity, it
That's
is
right.
not that's the time when you should visit your dentist, right?
Okay.
It's
Right.
never any delay to visit your dentist. And coming
Okay.
towards bleeding gums, I'll say if you feel your gums are swollen, the part
Right.
especially where your gums start, just above
Right.
the teeth structure, which we
Right.
call the zenith. If you have
Right.
any swelling over there, if you see rolled out margins or something like that, that's our
Right.
swollen gums. And that's the
Right.
initial sign of your bleeding gums. Or if you see
Okay.
your gums are not pale pink in color, they are red in color, the color
Okay.
has changed, I guess that's the time you should visit your dentist. Apart from that, if you have stickiness in your mouth when you wake up in the morning,
Okay.
you have foul odor or bad breath from your oral cavity that is easily noticeable by other people or you, that's the time you should definitely visit your dentist.
So basically, the color changes in the gums, the
Right.
marginal changes in the gums,
Yes.
and probably, the oral malodor or bad breath
Yes.
should
The
actually take you to
texture
the
and
dentist.
everything changes.
Okay, right. So, what would happen if somebody misses out on visiting the dentist?
Okay. So I'll say it's like when if you miss out to or you delay in this thing, right?
Right,
Now, if bleeding gums, if you're noticing that your gums are bleeding, and if you're not coming to your dentist, or if you're not visiting your dentist,
right,
it's a kind of infection you're having in your oral cavity, right?
right.
And it's an infection. It's going to go on increasing. The severity is increasing, right?
Right.
So when the severity increases, definitely it's going to be more harmful over a period
Okay.
of time. Now your
Right.
gums, the infection, if it's in the gums, over a
Right.
period of time, it's going to travel and reach your tooth supporting structures or say bone for that matter. Now, if
Okay.
it reaches your bone, it's
Right.
over a period of time, it's going to cause looseness in your teeth, or you can say mobility in your teeth. And that's the
Okay.
time when it's too delay or it's too late for you to visit your dentist because your teeth are mobile now. And that
Okay.
time it's the time when even your dentist can't help you much in most of the cases, right?
Right.
That eventually leads to tooth loss. That's a really small term for tooth loss, I guess. Now,
Right.
this is your entry point. Your oral cavity is your entry point, right? Now,
Right.
if your entry point is not healthy, ultimately
Hmm.
your oral health or your entire health is going to be compromised.
Right.
Your bleeding gums is just a small topic, but it can have a large impact on your body. It has been
Absolutely.
proved now that bleeding gums or your oral health is directly linked with your other health conditions, that is cardiovascular diseases like heart attack and all, then
Right.
your blood pressure, hypertension, thyroids, then even rheumatoid
Right.
arthritis or joint pains and whatnot. So it is
Okay.
always important to keep your oral cavity clean and healthy.
Right. Okay, so since you just mentioned that keeping your oral cavity healthy would automatically add on to our generalized health,
Right,
and so I would just like to come back to a very normal, a very common physiological condition, what we call as our hormonal imbalances.
right,
And two conditions we have in this is first would be adolescence, right?
right.
The teen age, which is very important and which is one growth spurt that all of us have to go through. So, are there
Yes.
any specific considerations that we should take into account while treating adolescents or
Okay.
growing children, especially when it comes to bleeding gums?
Okay. Okay. See, for this, I like to say if you say adolescents and children, these are typically two different age groups, right?
Right,
Now, if you say adolescents, this is the period when you experience growth spurts. So you have
right,
lots of hormonal imbalances. I
right.
would like to accompany this with pregnancy as well, and we'll
Okay,
deal with children as a separate topic, right?
right,
So, if you consider adolescence and pregnancy, this is the
right,
time when you have lots of hormonal imbalances going in your body, right?
right,
And the major two hormones which take place are the progesterone and estrogen, which are at the peak or they are fluctuating, always in the fluctuating levels, right?
right.
So, considering pregnancy, I'll say whenever a lady conceives, it's her
Right.
duty as well as the duty of a gynecologist to schedule an appointment with the periodontist as well. Both the
Okay,
gynecologist and the dentist appointment should go hand in hand
right,
because during the entire 9 months journey,
right,
her oral cavity will stay healthy. The
right,
periodontist will take care of the oral cavity. So
right,
during the 9 month journey, it will be the entry point which will stay healthy, right?
right,
Now, what happens during adolescence or the pregnancy period is the blood supply, or you can say the circulation to the oral mucous membrane is lots, there's increased, right?
Right.
And the gums, they become very sensitive to plaque or calculus, like I said.
Right.
So the tendency of your gums to react to your plaque or calculus or any infection for that matter, it is very
Right.
hyper. If you consider a normal man and a pregnant woman, there will be lots of difference because
Right.
there is hormonal imbalance. There is lots of blood circulation being done over here. So
Okay.
definitely there is a hyper reaction being given during
Okay.
pregnancy or adolescence.
Right.
So as I said, it is the dentist should take care of this, and
Okay.
pregnant women or adolescents, it is I advise that every 6 months or 4 to 6 months they get themselves checked, normal oral prophylaxis being done, and
Okay.
proper oral healthcare measures should be practiced during this entire period.
Right. So that automatically explains the increased, bleeding in the gums, or sometimes the increased sensitivity in the gums during
Right, right,
adolescence and
right,
pregnancy.
right.
Right. And, patients there, like we just discussed, that patients are occasionally unable to see a dentist. So
Oh,
could you offer advice on effective self-care techniques or at-home treatments for bleeding gums?
okay. So I'll say for this, dentistry, for it is don't take me in the wrong way, but dentistry I feel is the only field where you cannot just do your the medications are not just the solution for that. You
Okay.
need to visit your dentist. Your dentist needs to examine, and then accordingly you can carry out the medications or whatever the treatment for that is. But
Right.
in case if you're not able to visit your dentist for somewhat matter,
Mm-hmm.
then I guess there are lots of medicated toothpastes being available now in the market,
Right.
specifically for bleeding gums.
Right.
So those are very handy. Patients
Right.
can get hand on that. Then
Right.
there are various mouthwashes available in the market. Then there
Right.
are gum paints available. Apart
Right.
from that, I feel patients should always maintain their oral health. And now, if the patient has noticed that he or she has bleeding gums, the
Right.
first thing which he or she should do is visit the dentist and
Right.
then take a proper treatment. And then after that, as the dentist advises, carry on with the other medications. Because
Right.
even if you just take the medications and not visit the dentist, obviously
Mhm.
severity has to come down a little. Like it will come down 20% or 30%, but it will
Okay.
not rule out the 100% of the cause. So somewhere or the other, you'll have to visit the dentist, and to rule out the
Right.
entire cause, after visiting the dentist, the medications will do the other factors on that.
Right. Now, from the person who is actually suffering with bleeding gums to someone who's normal, so I feel that preventing discomfort brought on by these gum issues is always preferable to addressing it, right? So,
Right.
what preventive measures can be taken in addition to seeking this professional care for
Okay.
maintaining healthy gums?
Okay. So to address this question, I'll first say a small proverb that we have all been taught in the school days. That is, prevention is always better than cure, right?
Absolutely.
So, as now, whenever you have healthy dentition or your oral cavity is healthy, it is your duty to maintain it. The
Right.
first and foremost thing I'll say is visit your dentist at least 6 months in every 6 months.
Right.
Considering the Indian population, they are not that much. I'll say they are reluctant to visit the dentist, and
Right.
uh, considering the Indian population, they are always like whenever they have tooth pain or something, they'll that
Right.
time visit the dentist. And bleeding
Yes.
gums is such a thing that won't cause you pain or something like that, right?
Right.
It's just a discomfort which will happen, and
Right.
that's the thing which people are reluctant to visit, or they make a delay in visiting.
Right.
So I'll advise that you should visit your dentist every 6 months, even if you
Right.
don't have any pain or anything. It's just a checkup,
Right.
normal routine checkup which you should do. Apart
Right.
from that, I'll say you should brush twice daily. Then
Right.
in brushing also we have various other techniques available. For
Right.
children we have different techniques. For adolescents we have different techniques. And for
Right.
this there are numerous other videos available on YouTube which the patients can get a hold on. And
Right.
even the dentist can guide the patients on the brushing
Right.
techniques.
Right.
After brushing techniques, we have mouthwashes to keep your
Right.
oral cavity clean. I'll also
Right.
advise after having every meals, you make a gargles so that
Okay.
there's not no other food debris are left over in your oral cavity.
Right.
Other than that, you should follow interdental aids like flossing or other interdental aids like proxa brush and all. And
Okay.
you should always limit your sugar intake. Even if you
Right.
have sugar intake, it's my advice which I always give to my patients. Like even if you're having sugar, you should have
Right.
it before the meal, right?
Okay.
Before meal, if you have it, after meal, in the meal, you're going to chew a lot. So whatever the sugar has to be deposited is going to be washed off,
Okay.
and after that you're going to gargle. So
Right.
ultimately the sugar is not going to be retained in the fissures or anywhere in the oral cavity, so that's not
Right.
going to cause damage. So that's the
Okay.
only advice I'll try to give from my side.
That was some great advice by you. Dr. Ketan,
Thank
we really appreciate you being here with us today. And I'm
thank
hopeful that by sharing this knowledge, a lot of individuals will be able to regain their radiant and confident smiles. Thank you so much for joining us today.
My pleasure. Thank you.
And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again.